All right, so good morning, good afternoon, whichever it is. Apparently my mirror image isn't working again. Nope, there we go. Left hand, right hand. All right, so good morning or afternoon, whatever time it is, wherever you are. So this is video number 2, and today is the day before surgery. So to discuss some of the things that have happened or that have been taking place over the last 2 weeks since the last video, I worked out for about an additional week post video. And then I decided to go ahead and take some time off. I went and saw my massage therapist, Amelia. She's awesome. If you're in this area, Sierra Vista, or you're passing through, you need somebody who really knows what they're doing, man, send me a note and I'll get you her information. She advised through doing some research that we shouldn't do much in the way of manipulation of the shoulder area. The concern is that the muscles would elongate too much. There would be too much play, a little bit too much slack in there, which could cause some complications post-surgery. So she wanted to make sure that everything was in such a way that it wouldn't be too loose or too tight for when I go in for my procedure. So that's a good news story there. Let me close this Facebook thing out real quick. Okay, so what else has been going on? Well, I've been doing some other preparations. So you all know I'm kind of an open book, so if you have questions, I'll answer them. Maybe even more information than you might want to know. So for the last day and a half, what I've been doing is like a body cleanse, if you will, trying to empty my bowels, for lack of a better term. And the reason for this, my concern is the last surgery that I had, I woke up and I was ill. I threw up a number of times and they almost kept me overnight because of the nausea and vomiting. The other thing that takes place when you're dealing with a lot of pain medications, especially if you're talking like Percocet, Vicodin, they can cause constipation. So what I do not want to have happen is the day of or the day after the surgery, when the nerve block wears off, having to use the bathroom and it not being able to pass comfortably, right? So I wanted to clean my system out as much as I possibly could prior to going under the knife. Let's see what else we got going on post-surgery. So post-surgery diet, some of the things that I plan on doing. Here's one of them. I don't know if you're familiar with this product, Shakeology. So it's one of those Beachbody things. And it's one of the items outside of their workouts. It's one of the things that I really like, right? Because it's got a lot of vitamins, nutrients. It's very dense with its nutrition, which means I can use it in the morning as a pre-meal or even as breakfast, depending on how I feel. Post-surgery, it'll be lighter on my stomach than trying to sit down and hammer back, some scrambled eggs and toast or something like that. So that'll be the majority of my food intake at breakfast time, at least for the first couple of days. I usually just use it as something to make the cravings for sweets a little bit less. I snack on it. I'll have a shake here and there between meals. I don't usually use it as a meal replacement. So I'll be using that for at least the first couple of days, and the amount of protein to fiber. There's quite a bit of fiber in it, so that'll also help with my digestion. And then I'm using this here, hydrolyzed collagen. So this is the stuff that I was talking about on the last video that my chiropractor had mentioned would be a good idea to start taking. So I've been on it for about a month. I take it 1 to 2 times a day. It does suggest that you don't take it with another protein source. I'm not too concerned with mixing it with the Shakeology because it's got a lower protein count than a standard like bodybuilding protein supplement. Right, so we're talking like 9 grams of protein compared to the 32 to 45 that I normally take on workout days, pre and post workout. So this is supposed to help with the joints, the regeneration of some of the cartilage and the soft tissue as well. So we'll see how well it works post-surgery. Of course, I don't have anything else really to tie it to because this is my first time having a surgery like this. But if nothing else, at least I can look at what other people have said that their surgery and recovery time looked like, and base it on that. Though I can't. Well, hopefully I don't have to have the other one done. And if that is the case, then we'll be able to tell with and without. I could not take it for the next surgery. Let's see what else I wanted to talk about. Oh, I took my measurements today. All right, so as of today, the day before surgery, I am at 226.6 pounds. My neck is 16 and 3/4 inches, chest 44 and a half, probably closer to 45, but I was trying not to do any flexing in my back or lats. My arms, left arm is 16 inches, right arm is 16 and a quarter. I'm going to pay particular attention to these numbers post-surgery because the biceps tendon here is going to be cut, released, and then attached to the arm bone itself. With that being done, I'm curious to see what kind of effect that it'll have on the biceps itself. Right, so I don't know if these numbers are going to be skewed one way or the other post-surgery. Also, when I start lifting again, to see what kind of growth or stunted growth that it may have because it's not in its original position. My abdomen is 36 and a half inches, hips 42 and a half, thighs 25 and a half, calves 15 and a half. Now, so those are my numbers overall from the top down. And then I guess the next thing, I'm going to go ahead and adjust the camera a little bit so it's going to get a little wiggly, and I'm going to take a step back. What I'm intending to do here is show some of the issue that I have, some of the difficult areas and angles for my arm, and then also to show you my current range of motion between my left arm and my right arm. So this will give you and myself a frame of reference of where I began with my range of motion before surgery, and then as I go through the different as I go through physical therapy after the surgery, it'll give us, you and me, us, a frame of reference as to how much mobility I'm getting back. And then the strength piece, I've got numbers written down from my workouts over the past probably 7 months. So I'll have a good grasp of how much strength I have lost, and then how quickly I'm getting back up to whatever that mark was. All right, so let me adjust this a smidge here and take a step back. Pardon the shirtlessness and the chubs in the belly. All right, so some of the difficulties that I have with the arm is I can bring it up, but about here it starts to tighten and click, and then I rotate my back and I use my trap to help stabilize the arm itself. Right, so that hurts, and then upward rotation of the hand. Right, and there's a clicking and popping that you can't hear. It's not audible, but it's there. And then the rotation down. Right there, it gets a little hairy, and then right there it hurts, and I actually start to bend at the waist to alleviate the pain. Now, to get the arm back down, there are times where if I'm in the wrong angle, I actually have to reach across my body with my other arm in order to bring it into the down position. Mainly because it feels like it's going to pop out of socket. It's loose in there, and it's hard for me to I can't actually physically put my arm down on my own without fear of some severe pain in there. All right, so the right arm is fine, thankfully. The left arm is the one that I have some difficulty with and some pain. Now turning around the other direction, right? So here, my right arm, I can reach up yay far, tattoo towards the lower back. And then left arm, there's actually more range of motion in my left than my right currently. Right, so talking to a gentleman at physical therapy who had the same surgery done about, it's probably 6 weeks ago now. For him, he said even after the first month going to the position of parade rest, if you're familiar with military jargon, putting his hand in the small of his back, he was still not quite able to get the hand there after a month. So this motion here, rotating the elbow up and the hand back, was very difficult for him. All right, let's wiggle the camera back down there. So we'll see how all of that progresses as I go through physical therapy, and I think it's really about it for today. Tomorrow, my surgery. I've got to be up in Tucson. So I live again in Sierra Vista. So it's about an 1.5 hour drive. I have to be at Tucson at the surgery center by 7:30 to check in. I guess they're gonna, run some tests, take some blood, all that good stuff in preparation for 9:30 is when the actual surgery is supposed to begin. So I'm going to assume that around 9 o'clock is when they're going to start, pumping fluids into me, and shortly thereafter tell me to, count backwards from 10 or whatever they do from there. The surgery is supposed to take about 2 hours, and they say about because until they get in there, they don't know exactly what they're going to run into, how long it's going to take to clean up. If I'm lucky, if I'm lucky, the biceps tendon won't have to be removed and re-anchored, but we're unsure as to the full extent of the damage in the biceps tendon and the damage to the labrum. So if the labrum is too far gone, there's no way they'll leave the biceps tendon. If it's a partial tear and they feel comfortable being able to fix it and not move the biceps tendon, then cool, they'll go that route. So I won't know until I wake up, but even then I'm probably going to be kind of out of it and loopy because of the medication. So I may not fully realize what happened until the following day. I will try my best, folks. I will try my best to post a video tomorrow. If nothing else, maybe I can get my cell phone out, and record myself on the way home, playing with what will likely be a very limp arm because of a nerve block, and get that posted. So, but as always, hey, if you guys have questions, if you want to see the scars, I'm gonna ask and see if they can give me the video. If they can record it while they're doing the procedure, that'd be awesome. I'm sure for insurance and liability purposes, they're gonna tell me no, but I'll ask. And if I do get that video, then awesome. I'll post that on here too, so you guys can see what the inside of my shoulder looks like as they're in there cleaning it up. All right, so thanks for watching. Feel free to comment, tag people if you think this would be helpful for someone else, and ask any questions that you might have. All right. So on that note, I guess I'll be talking to you guys tomorrow.